Good evening and welcome to the Gambia Radio and Television Services broadcasting on MDI Road, Kanifing. Viewers and of course listeners out there, you're welcome to the first episode of the GRTS and Media Houses Sensitization, National Coverage Sensitization, looking at COVID-19 in general. I wish to remind viewers that this is a national sensitization program that the Ministry of Health, in partnership with the UN system, in collaboration with GRTS and all media houses, be it GRTS, QTV, Star TV, Paradise TV, iAfrica TV, and MTA Gambia, plus private radio stations, and of course community radio stations, will be airing this very program to sensitize the general populace about COVID-19 in general. We have a lot of thematic areas on the lineup, and we'll be having a lot of guests in our studios. But I just want to add that this specific program will be relayed on all these television stations: GRTS, QTV, Paradise TV, Star TV, MTA TV, and iAfrica TV, plus all the community radio stations in the Gambia, and of course the private radio stations in the Gambia, meant to sensitize the public about COVID-19. We are in COVID-19 period, and we have to talk about COVID-19. Gentlemen, welcome to GRTA Studios here on MDI Road, Kanifing. And first I will want to allow my guests to introduce themselves proper before we go deep into the program. Sir.
Thank you, Mr. Njai. My name is Lamin Kanyi, Senior Program Officer, Ministry of Health, under the Directorate of Health Promotion and Education. It's a pleasure to be here.
Thank you very much, Mr. Kanyi.
Yeah, so thank you very much. My name is Yawa Marsila. I am a lecturer at the Gambia College School of Public Health, and I also take part in the COVID-19 risk communication and community engagement team for the Ministry of Health.
Thank you very much, Mr. Silla. Welcome. And of course, he needs no introduction, but I will allow him to introduce himself again.
Thank you very much, Mr. Njai. Yeah, my name is Prince Bubakar Aminata Sankano, or Sankano, focal person for strategic communication at the Gambia COVID-19 Response Coordination Secretariat, also member of the Risk Communication under the National Health Emergency Committee. Good.
Thank you very much, gentlemen, for coming to this important sensitization program. And viewers and listeners equally, I am your host for this program, the first episode for that matter, and I am Momo Njai, and we will be going through this 45 minutes of television and radio program, courtesy of the UN and government of the Gambia, together with the Ministry of Health partnership for this important sensitization. First, we will start with a very important thematic area this evening, which is going to be on non-pharmaceutical measures. I'm sure we'll be using a lot of medical terms here, but we have personnel who are here to break those terms for the general understanding of everyone. And as I said, the thematic topic that we will be discussing this evening will be centered on non-pharmaceutical measures. And this is where I would invite Mr. Lamin Kanyi, who is from the Ministry of Health, Senior Program Officer, to give us an explanation of what is meant by non-pharmaceutical measures.
Thank you, Mr. Njai. When we say non-pharmaceutical measures, these are actions or measures people and communities can take to reduce the risk of COVID-19. It is very broad, but we'll focus on key areas for the benefits of our audience. Yeah, we'll focus on hand washing, use of face masks, and physical distancing, and coughing etiquettes. So these are the principal areas that we'll center our discussions on. But when we say non-pharmaceutical measures, these are measures or actions individuals, peoples, and communities can take to reduce the risk of COVID-19.
Good. Now, these are measures that individuals or communities can take to reduce the risk of COVID-19. I think this is a very timely topic. When we talk of COVID-19, there are a lot of issues surrounding COVID-19, and this is something that we cannot do without. This is something that we're living through, and this is why we need to talk about these issues and, you know, face it. COVID-19 is here for a while, and definitely we need to talk about these facts. Now, let's go into the measures proper. What are some of the measures one has to take as far as, you know, preventive measures are concerned regarding COVID-19?
Yeah, thank you very much. Firstly, we'll begin with hand washing. It's one of the non-pharmaceutical measures for COVID-19 prevention. When we say hand washing here, we advise people to wash their hand with soap and clean running water. Or an alternative option could be use of alcohol-based hand sanitizer. This can be another option that we can use to at least cleanse our hands to break the chains of transmission of COVID-19. The second thing is we make sure we practice what we call coughing etiquettes and avoid coughing in our hands. So when we say coughing etiquette here is to cough on bent elbows. This will at least prevent our hands from being contaminated, so that, and also to avoid handshakes.
Okay.
Once we cough in our hands and we shake hands, that will serve as a medium for transmission for COVID-19.
Okay.
But we all know here, at the bend of our elbow, people hardly touch that.
So where should coughing be done exactly?
Yeah, like this.
Okay.
Yeah, it should be.
I think the demonstration is also very important.
Very important.
Because some people, we have this, sometimes some myths and misconceptions, like when you cough, what is this? So some will just want to leave it open air, but that I believe is risky.
Yeah. So we will advise the general public to avoid coughing in their hands, but also to at least use this one, bent elbows. That's the coughing etiquette advised by health expert. The other pharmaceutical measures that we can use is to make sure we practice what we call physical distancing and also social distancing. When we say here physical distancing is between you and this other person, there should be a gap of 1.5 meters. Because when an individual cough, there will be release of particles or droplets from the nostrils. So when you are close to the other person, there is all tendency that this particle may land into your body orifices, your mouth or your nose or your ears. In that it will be get into your system and you'll be infected with COVID-19. So this is why we advise people when they are in the public or in gathering, there should be a spacing for 1.5 meters between people. The other one we advise people is to put on face mask and avoid attending crowded places. So these are very good measures that we can help model ourselves to take it as a new normal behavior for COVID-19 preventions. We lessen the number of visits we'll make to crowded places, and if we are going there, then we have to use at least a face mask. This can be fabric mask or this one, surgical mask.
Good.
So we use that one to prevent ourselves.
Yeah, that is where I was even going to come up, and that the issue of the face mask. We've seen different type of face mask on display. One is the type that you've actually worn. You've also talked about the fabric. But now, in terms of sustaining the use of these face masks, how frequent should one be changing this face mask?
Yeah. So like if you use a face mask for a day, if it is surgical mask, at the end of the day you need to change it. You cannot use it for the following day. Because there is all possibilities for contamination. At least we have to at least change it on daily basis. If we are to use a fabric mask, after a day you need to wash it clean and then use it for the other day. That's going to be our advice for the general public.
Good. We will still come back to you because that issue is really things that we need to expand on. The issue of the physical distancing, the use of the face mask, and of course the use of hand sanitizers. These are important topics that we really need to shed more light on. But at this point, I would just want to invite Mr. Sehu Omar Silla, who is a lecturer at the Gambia College School of Public Health, also a member of the Risk Communication Unit. Mr. Silla, there are a lot of myths and misconceptions regarding COVID-19. Some believe COVID-19 doesn't even exist. Some believe it's an imported disease and other things. Can you share with us your perspective on this subject?
So very well, it's always interesting to talk about misconceptions of COVID-19 because I will drag you back to history of when COVID-19 started. When all around the world people were saying, this is politics, there's nothing true about this. And then I remember when COVID started, I was in Wuhan myself. that was the city I was studying.
Wow.
And
you from the epicenter?
Of course, the epicenter.
At that time, not now. It's important people know.
At the time. And when I returned just weeks after the outbreak started in China. And I met a lot of people in the country who were saying, I mean, this is just a fight between China and America. I mean, so those kind of misconceptions started very early. And then until some 3 weeks after that, we started having other misconceptions and people saying, okay, look, this is a disease for the white and not for the black. I mean, black man can never be infected with COVID because we're seeing upsurge of cases. We're seeing, number of cases doubling up in China, in America, in Italy. So it's not a black man's disease. And then after it started invading into some parts of Africa, he said, okay, look, it's a white African disease, white African disease because it was in Egypt and Tunisia, and it's not yet in black Africa. So
and some would even tell you, I don't want to cut you short, some will tell you you cannot even survive in this part of the continent.
Of course. So the climate sensitivities also started coming. People saying, you know what, it cannot survive. But I've been to parts of China that are quite hotter than Gambia. The example of that part is in Guangzhou. The temperatures are quite more hot than it is in Gambia. So those misconceptions also started at the time. But now we have certain misconceptions, and that are very important for us to address. And these are coming with a lot of disinformations and misinformations into the public space. One I will start with is the issue of the gun thermometer. So the gun thermometer, we use it for temperature checking because temperature is one of the cardinal signs for the COVID-19 symptom. So many people in the country perhaps think, when you take a gun thermometer and I shoot it to your head, it's detecting that you are COVID-19 or not. No, the gun thermometer is not indicating that you are COVID-19 or not.
So what does it actually do?
It's just a temperature reader. It does read your temperature because we know that a certain temperature, a higher temperature, is a cardinal sign for COVID-19. So that is one thing I want to discuss on as far as the misconceptions are concerned. Because I've met some people who would, when you are at the bank or the institutions, when they come and stand and you take the gun thermometer and you point to their head and they'll tell you, okay, so I have no COVID. So that doesn't indicate that you don't have you have COVID or not. So it's not a testing gear to indicate the presence of COVID-19 virus in you. So let's have to, we have to be careful with that. So the other misconception is about the issue of many people thinking that, like we discussed, COVID-19 is not a black man's disease. Of course, COVID-19 is invading all around the world. We're seeing it now in Gambia. Here we have cases. People have died. 100 plus people who are Gambians have died. So there's nothing that is different for our characteristics to other people in other parts of the world. So whatever happening in other parts of the world is happening here. So we want to say that COVID-19 is for all. So we have to be very careful. And there are other misconceptions, of course, on the issue of hand sanitizers. I think sometime 2 weeks ago I was on a radio program and someone called and said, the use of hand sanitizer is really bad. So no, there's no scientific evidence that is suggesting that too much use of hand sanitizer, proving that it's actually bad. So those are also very serious misinformations in the public space. And I've also had people talk about the use of face masks, that when you use face masks for quite a longer period, so interferes with your the oxygenation into you. And that has also been addressed at the level of WHO, that there is no evidence suggesting that the use of a face mask will interfere with your
but one thing, I'm sorry to interject there. Some of these misconceptions, are they coming from the medical fraternity or they just coming from the general populace themselves? Because these have to be medically proven. Yeah.
So there are two things with COVID-19, and that's why COVID-19 is dribbling science, and at some point information about COVID-19 was changing. So an ordinary Gambian or an ordinary somebody who's not a medical expert wouldn't understand what is happening. So because when the investigations change, when things change about the virus, you have to come up with new information on the virus. So the general public wouldn't understand. This is really what's happening. So they think, oh, you know what? So there's a lot of myths and pieces of the same information coming on and on. So that has also been another problem, and that's why we always try to be on top of the issue. We want to be on top of information, so that anything that comes up, we take it from the scientific brief. So the WHO is publishing what we call a scientific brief to address some of these misconceptions, to its member states, and we are relying very hard on that to ensure that all evidences that are coming up for all arguments are addressed, in a shortest period of time.
Now, just to add that. Something to that, Mr. Silla, what information do you have for somebody who is watching this program out there and still have that belief, these people are just talking, it doesn't exist?
So COVID-19 is real.
Because I want to be honest, somebody is watching this television right now, looking at my face, at your face, and at the faces of all of us sitting out here. This doesn't exist.
Yeah, so it's very much disheartening, and we know that from the histories of pandemics, it always comes with infodemics. I mean, there are people that would resist even if they know this is true.
Exactly.
And there are other people who will just resist because of the lack of information, or sometimes it could be based on other reasons. That could be political, could be obviously for other reasons that you wouldn't tell. But COVID-19 is true. I mean, if we are in Gambia and you know what's happening in the country, you would definitely believe that COVID-19 is real. I mean, the government has put in a lot of investment into the fight against COVID-19. I mean, you're seeing how we have been struggling in the healthcare system. You see how limp our healthcare system wanted to suffer at some point. So all those things didn't just happen. If really COVID-19 is not true, we're seeing the cases of lockdowns. I mean, nobody will lock down a country.
Looking at the economic ramifications of all this,
and all that. Even the health consequences of, because when things like this happen, some people out of fear wouldn't even want to go to the health centers. So, I mean, as health personnel, that is not.
I think that is also even a separate issue that I wanted us to discuss here, the issue of myths and misconceptions, looking at even now patients who are really sick, but it might be or might not be something related to COVID-19, but they're still scared to go to hospital.
Yeah, exactly. And we had some of those problems sometime in the mid of last year, where the coverage for the case of certain vaccines, certain essential vaccines had dropped significantly in the country. And in fact, coverage when it comes to people going to seek medical care has also dropped because of the fear that, COVID-19 was in the country. And so, all those things are misconceptions, because the Ministry of Health did very well to dual track the health system to ensure that it was caring for COVID-19 cases and at the same time caring for other routine care cases, the diabetics, the hypertensions. So if you fear not going to the hospital when you're suffering some of those non-chronic chronic diseases and you're sitting at home, you're just exaggerating the disease in you. So the condition will worsen because you need medical care. So we don't have to run away from our facilities. We don't have to run away from medical doctors. Before COVID, it is the facilities that we have. Before COVID, it's the same doctors that are in the country, the same nurses, the same public health officials. So we need to maintain building trust between us as care workers and the general public. And the general public should know that health workers, we were there for them. So we will not just play games or do anything that really is not true about this.
Health workers, we are here for them. I think that is very encouraging. So it's important that one keeps going to these hospitals and getting yourselves checked up for any kind of ailments, as health workers have given you that assurance that they are here for them. And of course, health workers are equally prone to any diseases, exactly. I believe. So thank you very much, Mr. Sile. And now, Mr. Sankano, at the level of government, what have been some of the response that government has done since the advent of the COVID-19?
Yeah, thank you very much. The government, the first thing is to set up the National Health Emergency Committee as an expert, entity, cross-cutting, in the intergovernment, involving also a development partner, making sure that it's a structure, because COVID is a new thing, and we need to have this structure wasn't in place. Advise government. That is the technical level. We also have the cabinet subcommittee on COVID-19, which is taking political decisions. So having a structured at government level, making sure there's coherence, communication, exchange of information, and looking at that, also updating our communication strategy, like the Ministry of Information and Communication Infrastructure updated our communication strategy, making sure that since COVID is dynamic and the messaging is also coherent and dynamic, as my brother from the public health and also colleagues say, it keeps changing.
Exactly.
A good example is before people were symptomatic, and now we have more people are becoming asymptomatic.
Exactly.
So communication is also changing. Disinformation is a challenge. All those conspiracy theory, but we understood as policy level that these are coping mechanisms. When there's a new situation, people look for answers, and they need to come forward. Like when somebody is bereaved, somebody died, you deny it first. It's not true. I spoke to him this morning. He died. How can it be? So all these misconceptions, we categorize them as coping mechanisms and targeted response with information, with more policies in place. And like you say, based on the advice of the committees, then the government will come with a press release through the Minister of Justice and also through the Office of the Government Spokesperson, advising the public on the steps to be taken. So this one has always been based on scientific evidence. Okay.
Now, the whole world is stunned by this issue of COVID-19, and the Gambia is, of course, no exception. What are some of the challenges as government you have faced during this era of COVID-19 that you will wish to share with the public itself.
Yeah, what we understand is, most of the measures are cultural shock, like, social distancing. So as a government, we realize where we are coming from 22 years of system which was repressing human rights. Then how do we fight this pandemic while safeguarding the fundamental rights of Gambians? And that's why if you look at the preamble of all, yes, if you look at the preamble of all the government policies, especially lately, right now we have the Public Health Dangerous Infectious Disease Regulation 2020. It is very elaborate on the preservation, protection of the human rights of Gambians. And this is why we are trying to be as surgical as possible. That's why people say, the government is not serious, but we understood where we're coming from. From the day we are born to the day we die, Gambians, Africans, we are always together. And if you come 24 hours and say separate, it's going to take time. And that's why we say we use force as last resort. In all our argument, we say force is the last result. Even when they deny, people are saying that they don't see COVID-19 patients, we say protection of privacy is paramount.
It's important.
Whether you believe it or not, we are not going to put camera on COVID-19 patients trying to expose them. And also making sure that
it doesn't make sense.
Doesn't make sense, And also making sure that government is the bastion of credible information. We tell people, fine, go to the social media, consume whatever you want, but before making decisions, come to the government. And this is what we've been able to achieve. In the beginning, people were rushing, they tried to take the laboratory results. I say, why is it that the social media is faster? We say, look, we follow the due process. They said, we have Gambia PCR 24-hour testing, we wait for the laboratory result. People can say whatever they want to say on social media, but government will always come with the facts. And this one, we've been able to change the narrative in favor of the government.
Okay. And so far, have there been collaboration from the public?
Yeah, for sure, it's gradual. People are really coping. I mean, like I said, especially this one is automatic. With figures rising, we see people behaving. So whenever, especially when the regulations were relaxed, people also relax. So they tend to blame the government. You relax the regulations. Well, we understood, because at one time, people were tight. And human beings are not used to being suppressed in corner. Human beings we are born free. So, and if you look at the mood of the population, it was very somber. People were in a lockdown, in a restrictive movement. After some time, as a government, you consider that the public feeling. So you open up. And that it was open with responsibility. That's why we still have the mask regulations, all the penalties are in place. But we understood that, it's a cultural shock, persuasion, sensitization. And then with the numbers increasing, these days, we see people are wearing masks, even without government coming with a new directive. So that one is helping us. And then with the trajectories, figures coming in, decisions are made accordingly, and the public will.
So in a nutshell, government is trying to be flexible with the situation.
Indeed, flexibility and making sure that force is the last resort, and this has been the bottom line, from the beginning. Force is the last resort because we are in an extraordinary situation where we don't want to encroach into the fundamental rights of citizens that much.
Exactly, I think that's a very important point. Mr. Kanyi, the issue of hand sanitizers and of course use of face mask and of course soap and other detergents to use during these preventive measures also comes with some few guidelines, I believe. Some will just want to use soap, the same way they would want to use it, somehow. Are there some few tips you would need to share with the general public in terms of how to use soap, how to use sanitizers, how to use a face mask? How exactly is one supposed to use these preventive measures?
Yeah, generally, like as we said, COVID-19, one can say is here to stay. So we have to at least adjust ourselves to adopt the new normal behaviors. And this calls for adherence to new pharmaceutical measures, one of which is hand washing with soap and clean running water. When we say hand washing with clean soap and clean running water, it's just you wet your hand and you put on a bar of soap and you wash your hand thoroughly, back and forth under your nails, etc. This has to be done thoroughly. Okay. And then when we say you put on a face mask, it should not be done haphazardly. When we say face mask, it has to cover your nostril as well as your mouth, because these are the routes through which COVID virus can get into your system and harm you. And then when we talk about physical distancing, we advise for 1.5 to 2 meter spacing, because when somebody coughs, the particles will, they are aerobic. They'll be in the space, and then if you are close, within a close proximity, you will ingest this thing into your system. And this also calls for ventilation of closed areas.
Exactly.
If you are in a place that is confined, you need to ventilate the place so that when somebody coughs, it can at least be blown away. And then therefore we also advise for coughing etiquettes, coughing under the bent elbow, not necessarily in your hands.
Okay.
And also this has some, habit modification. That is, we have to avoid touching frequently surfaces
Okay.
to avoid contaminations.
Good.
So it calls for behavioral modification, at least to adjust yourself to the new normals.
Okay.
Okay?
Okay.
Because these advices that we are giving, it's not a new thing. People have been washing their hands.
Exactly.
For example, Ministry of Health, we run a program called 4+2. In this, we advise for hand washing at 4 critical times. So the same principles applies here.
Okay.
We just have to at least adjust ourselves to get used to this, and also to avoid, touching, surfaces that are, frequently touched by others, to protect ourselves as well as our family and the general public from COVID-19.
Okay. Good. If you're joining us just now, this is the National Sensitization Program on COVID-19, relayed on JRTS, QTV, Paradise TV, Star TV, MTA, iAfrica TV, and also linked to private radio stations and community radio stations. This is the first episode of the thematic areas that we will be discussing, and this evening we're discussing centering the discussion on non-pharmaceutical measures. And in the studios I have Mr. Lamin Kanyi from the Ministry of Health. He's a senior program officer and he's discussing on the general preventive measures. And of course next to him is Sehu Omar Silla, lecturer, School of Public Health, and of course member of the Risk Communication Unit, and of course Mr. Abubakar Sankano from the Ministry of Information and Communication Infrastructure, and of course a member of the Risk Communication Unit COVID-19. Going further to the discussion, we have seen that during the commencement of COVID-19, when it was so heated in the beginning, we've seen a lot of Gambians taking it seriously. We've seen at institutions, you have seen, sanitizers, buckets, and here and there being placed at strategic locations. But realistically, when you go around, you have seen a diminishing, figure in some of these things. Why do you think this is so?
So that's very interesting. I mean, if you understand, this is dynamics.
I mean, some have even started taking it out.
Yeah, obviously. If at some homes today you walk in, I mean, the buckets are more dirtier than ever.
Exactly.
Things like that. So you understand this. You should understand the nature with fear factors when it comes to pandemics. I mean, when things start new, when the information is huge, and in communications for health messages. I mean, there are various types of communication for health messages.
Exactly.
And then when COVID started, the type of message that was coming out, the mechanism of the messaging was a fear appeal message, where people were so feared with the numbers that were coming out as far as the COVID cases are concerned. So we're seeing a drastic, surges in numbers, 100 dying, 200 dying in an hour.
Exactly.
So that fear is what has actually provoked people to take things serious. So at some point now you start seeing figures coming down a little bit. So it's like a mood swing that is attached to number.
Yeah.
So
but let's face the reality. The numbers are going up now.
Yeah, exactly.
And now you'll see. Do we have to get back to the old system of doing stuff?
Yeah, so you see, when it started in a period of March, you see the mood, in the general public.
Exactly.
I mean, everybody is eager to get information. Everybody is just eager to, do something to prevent themselves.
And there were shortages of buckets and soaps and sanitizers.
And all that. So it was very interesting. I mean, at the time it was nice.
Exactly.
But then you swing down to July, August, September, when things started coming down, and everybody was relaxed because we're so attached to numbers. I mean, we need to understand that behind every number is a life. So it's not just about 50, 60, 70, but this is about it's an individual life. So when the numbers come down, other people will be like, okay, I mean, this is not true. And in fact, the other problem is, the numbers really exaggerated in Europe. I mean, the conditions in Europe, the setting is different from Africa. We've seen, mass infections in Europe, and we didn't see that happen. Thank God we didn't see that happen in some parts of Africa. And so people are like, okay, if this is real, why is it happening this way in Europe and not happening that way in Africa? So others started relaxing, for the measures again. So, but COVID, we have to be careful for COVID not to meet us off guard, because we need to learn our lessons with COVID-19. And I think Gambia and Gambians should be very careful of not taking things serious. We're seeing numbers, coming up a little bit again, and still we have this informer saying, okay, they are just exaggerating these numbers. Where are they getting all these numbers? So we don't want to be getting, we don't want to be too relaxed, getting those information and think that everything is normal, and one day COVID will meet us off guard again. Because if that happen again, really COVID-19 is going to suppress our health system. We know that Africa's healthcare system, is limping. There's so much pressure on Africa's healthcare system. So we cannot just allow COVID-19 to put too much pressure. When we have dual pressure on the healthcare system, we will not have the response power. So when we don't have response power in the country, that is going to be serious because we cannot cope with the situation.
Good. Now, this is a myth I just want to share and a misconception here. Sometimes you hear, within the grapevines that sometimes governments just saw this number of cases for economic reasons. Is that so?
Well, I don't want to laugh about
these
that.
are myths that goes around.
Yeah, of course.
Because sometimes you see the numbers going down. In other countries, you see the numbers going up. So the last time I had this, they were like, Gambia needs to increase their numbers. I said, why?
Okay.
They told me, look at so-and-so country. The moment they raised their figures, they had so-and-so millions of help. Why wouldn't Gambia raise the figures so we can get more help?
I think anyone hearing, Sakana would obviously laugh.
This was something I had seriously from various corners, and I was like, oh my God.
I understand, and we have a very peculiar situation for the country because unfortunately some of these things happen when something happens. So to detach the event happening and the numbers coming up, detaching it from together, will not convince a lot of individuals.
Exactly.
But governments will. There is no government on earth that will definitely
play
just
around
swell up the
things.
numbers, romance the numbers.
Exactly.
Just to get money. People are running away from COVID.
Exactly.
Government will be
I
proud
think you need to say something on that.
I'm saying that we need an active and healthy production.
Exactly.
Population for
Exactly.
productive economy.
Of course.
Exactly.
We are talking about moving from handout.
Exactly.
Saying that having field hospital.
Exactly.
That one is a trick. We need a healthy population.
Exactly.
Because that's what is important.
Exactly.
If a shopkeeper and his family are not going to shop, even if they get a bag of rice, that's not enough, and it's a loss for the economy. The tailor is not going to show. Many women will be queuing up in our clothes are not ready, so they don't know the effect of the economy. Having higher number is higher.
Yeah.
Exactly.
The money that is coming is nothing compared to the loss to our economy. Look at Saudi Arabia. The amount of money they lost from Hajj is in billions.
Exactly.
So no responsible government will. It's
play
part of
around
the
those
coping
things.
mechanism, as we said, and it's part of the system that we are seeing. But like I say, as authorities in charge of COVID-19, I say we are between the devil and the deep sea. Whether we do it right or not will be blamed.
Exactly.
And initially we got projections that we are going to have about 181,000 infections if we don't do our job. I said that we did our job, and that's why people were relaxed. Because figures went down. So it was a success. In German they will say that because we have become victim of our successful preventive measure because Gambia, even later, we detect early. What we were doing before, the quarantine system was very expensive, but we detect early. We test you three times within 14 days and release you. So the early intervention helped us, and that's why people were relaxed. And also along the line, politics came in, the issue of money came in. Gambians and dollars, they thought that the money is raining. The 500 million definitely made life difficult for us in charge of communication in COVID. So along the line, but we gradually we've gone beyond that, and I believe that this time around, what my brother highlighted on this are sustaining the behaviors. This is the challenge now. I believe that with the second wave, we'll be able to do that one.
Good. Now, Mr. Sankano, we have seen that people have now started going back to the previous life, going about their normal business as if nothing has happened, going about social gatherings as if nothing has happened. We have seen, things going back to normalcy in a circumstantial manner. Are there plans by government to come up with regulations to be able to come up with modalities to see how best to curtail some of these situations, since the fact is the cases are rising again?
Okay. Yeah, two things we have to understand. In the beginning, we invested a lot in making sure that people know what is COVID. So we succeed in making sure there's nobody in the Gambia who doesn't know what is COVID.
Exactly.
That's one is achieved. The second target that we are facing right now is to know that, like my brother highlighted, COVID-19 is here to stay. It's here to join the family of respiratory diseases. The expert in public can tell me. So it's not going anywhere. And I think the public has internalized that one. And that's why we see, fatalism, acceptance. But, sustaining the behavior. Government is doing part. This week, the Minister of Health is reviewing the public health bill, making sure that our laws are dynamic and the response. And today there was a high-level meeting. Decisions will be made, based on on the trajectory, and then the public will be involved.
Good. Now, but let's face the fact: do we have to wait for government to come up with measures, or individually we have to change our attitudes?
Yeah, the government sets the platform. Yeah. Everything falls down to the government.
Exactly.
So the government is there as an arbiter of good behavior, rectitude.
Exactly.
So the public is to carry along. Even if like I said, all these masks and all that, people wait for the government.
Exactly.
There are still people who are waiting. I'm not going to wear a mask until and unless the police charge me, or until I'm shamed to go and clean the market. So they wait. There was a time whereby the public hunger for enforcement was high. Why is the government not enforcing? They want to see government. You say, look, the force is last resort. We want you people to internalize, because if you force somebody, the person will do something just to appease you. But training, internalizing this behavior is more sustainable than trying to force people just to do something, as we say, eye service.
Exactly. Because looking at some of these measures we've talked about, the use of face masks, the use of sanitizers, the issue of physical distancing and others, I have the belief that we should not wait for government to tell us to do this. Individually, these are issues that we need to take up ourselves as our individual responsibility, rather than waiting for government, because at the end of the day, government will only have to use their last resort on the citizenry. So I think it's important that attitudinal change is really adhered to and respected at all levels. Now, with regards to the issues of hand sanitizers, which I was also talking about, and the issues of physical distancing and the like, in our homes now, this is where I want us to do the focus on. Culturally, Mr. Sankano has said it, whether it is in our homes or whether it is in societies and the like, we have been used to, sticking together. We've been used to doing things together. We've been used to eating together. We've been used to, crowded stuff. The coming of COVID-19 has actually created a new norm, which will mean we have to do that physical distancing here and there. What do you think would be best practices in our homes?
Yeah, the best practice in our home will be when we feel that we are sick, we have the feeling of being sick with fever, and we are coughing, sneezing, we have to at least isolate ourselves from the rest of our families. Okay? And then we have to at least call the 1025 hotline to report ourselves to the health workers who will be in charge to at least help you, get out of this thing. Yeah. As we said, the dispensation of our own health is our own, lies in our own hands as an individual. So we should not wait for a health worker to at least, direct us what to do. Our role is to give you the information, but the acceptance has to be done by individual, and they have to put this into practice. It is, pleasing if you go to these institutions, the bank and some, big shopping centers. There is a policy in place. You cannot get in to the bank without putting on the face mask. So the same thing has to at least be brought forward to our, houses, and we have to make sure that when we realize that, we have somebody, who travel outside Gambia, we should at least give an allowance of, 2 weeks before they mingle up with our families. This is for our own protection. So as we said, we have to at least adopt new behaviors to live, amicably with COVID-19 virus, to protect ourselves as an individual, our family, and the, population at large.
Okay. Now, Mr. Sila, I want us to discuss about the issue of stigma and discrimination on COVID-19 patients. I think this is very important for people to hear about. In terms of, having stigma and discrimination around, patients or, people that you think are suspected cases of COVID-19, are you facing these kind of issues during the course of your job?
Yeah, so interesting. When COVID started, I was in the call room. I used to work at the 1025, located there. And at the time when individuals call, or when we call individuals and asking them that the results are out and we're coming for them because they turned positive, I mean that's just something. It used to be very serious. And I remember. But
some also jokingly say the way you come for them makes them.
Yeah, so I think there were some issues, of course, at the start, because the hype was so high, and then when we were going.
Because you see people with face masks and ambulances.
Yeah, you see somebody coming down in your compound on white clothing. you see the ambulance, making the siren. So the hype was so high, and then but we realized later that that was not proper. We needed to change modalities in picking up service and things like that, and we achieved in changing the way in which we were picking up individuals. Like I said, it was the hype, but later we learned some lessons on that. Of course, the issue of stigma and discrimination, I think it's really even affecting the coverage for testing. People are not really coming out for testing. I think one of the factors for that could be because nobody want to be associated with COVID, and nobody want to be associated with a suspected or confirmed COVID case. When COVID started in the country, I remember when we used to have, I wouldn't mention communities, but there were certain communities in the country. People started distancing themselves from those communities because when the hype was so high, there were people that were positive and coming from those communities. In certain compounds where people were positive, individuals were just distancing themselves from those communities. So that also
that could have a serious,
of course,
serious
social exclusion is serious in fighting any serious pandemic because because of COVID-19. Kanye will tell you how it feels like being locked down in a house in Wuhan or somewhere in Malawi. Not having anyone to talk to. That in itself is serious. So I think the issue of stigma and discrimination is very serious for this country. But I'm also glad that the Minister of Health did a fantastic job when it comes to our communication. I think communication stands out as the best pillar in the fight against COVID-19 in this country. Just we can raise our hands high, not because I'm part of the team, but I know the work in the background.
But those of us in the broadcasting
exactly.
We can attest to that. There have been series of activities happening on
so I think
TV and all other radios and television.
So communication stands out as the best pillar when it comes to the fight against COVID-19, and that it should in fact be like that because communication makes other pillars work. Without communication, other pillars wouldn't work. And so Ministry of Health did a very good job when it comes to the issue of stabilizing issues of stigma and discrimination in communities. We had community engagement where counseling services were perfect. When we go to people that were affected, talk to them, and look, this is just COVID, and anybody could be victim of COVID. And then society started understanding the realities of COVID-19, and then that reintegration of bringing back patients into their communities was a problem at the start, but now it's no more a problem because COVID-19 has almost becoming something so normal, and I love the fact that COVID is getting so normal because it's not going anytime soon. There are no signals that COVID-19 is leaving anytime soon. There are too much dynamics. We know that there's a new variant for the virus, so that in itself is becoming another problem. So we cannot just start dancing that we are winning against COVID-19. I think the fight should be reactivated. The battery would be recharged.
Should be continued.
Of course, very well.
Good. Mr. Sankano, are you concerned about the issue of stigma and discrimination for some of these patients for COVID?
Indeed, that from the beginning we said that we've done a part, and I was part of what I call the suicide commando, going to the difficult communities whereby people they wanted to kill us just to go, and then so it was really tough in the beginning. We really put our neck on the line in saving the country from COVID, but we've achieved our objective in beating the stigma, and now the global the dynamics are making life easier for us. Remember last year we were at turntable trying to encourage people to embrace voluntary testing. People are saying no, but in a day I get more than 10-20 calls, people asking for where to go for tests because they want to travel. It has now become a global precondition for traveling. So there are developments on the global travel market, which makes basically, so we don't need to even make it compulsory here in the Gambia. Like this morning I say if Saudi Arabia said that anybody who wants to go to Mecca will have to do COVID-19 testing, of course people will do it, and so we are on the right track. We just need to sustain what we've done and also modify. As you say, we have a new strain, and then we are learning, and then Gambia definitely, we need to applaud our response mechanism, and there was a survey, a global ranking on genome sequencing. Gambia is number 6. So which means that we have the local capacity, the human capacity, our people in the lab, in the science, in this thing. We've done a lot, We've done a lot this year. That's why COVID-19 has not been that disastrous for us. Although, of course, as a developing country, it has been devastating, but the impacts, we are mitigating it, and then I believe that, we are on the right track if we sustain the new behaviors.
Good. We are on the right track if we sustained some of those behaviors. I think that's very important, and there is communication in it, and of course the ministry have been doing a fantastic job as far as the issue of COVID-19 is concerned, but I think the issue of attitudinal change is very much important for people to really start changing their attitudes as far as COVID-19 is concerned. Mr. Kanye, I've just been informed that we have few minutes to go to wrap up this program, but before we we close this program, what message would you have for viewers and listeners? Out there?
The message I will give to our audience is to at least we make sure we adhere to preventive and protective measures for COVID-19. What that is hand washing, practicing of coughing etiquettes, physical distancing, and also avoiding going to like crowds or gathering. And if you have no option or alternative to go, if you are going, please put on your face masks. This could be surgical masks or fabric masks to protect yourself, your family, and the general public from COVID-19.
Before you end up that, where should one be putting on face mask? When you're going out, when you're in public, or when you're at home? Where?
Yeah, when you are going out,
you can put it on.
in public, you can put on face masks.
Okay.
Yeah.
Okay. I think that is very, very important. Mr. Silla, your final remarks?
Yeah, so COVID-19, just to say that COVID-19 is here, COVID-19 is true. There's no politics behind COVID-19. I mean, the numbers that we are seeing on the Citizen report is true. The report that the Ministry of Health is doing on every information on COVID-19 in this country is true. Anybody can work in any way and validate those information. And just to remind people, especially, I think there's also one behavior people are doing. I wouldn't want to go out without saying that is sharing the face mask. I mean, you go to banks and they ask you to go and put on a mask, and so you tell somebody,
you just have to step aside and just get it from somebody.
Can I use your face? I think
How risky is that?
Yeah, that is a very risky behavior, and I think that is really going to suppress the response power. The effort that we will put in the fight against COVID-19 would not be very nice if those types of behaviors continue in the public space.
Yeah. I believe it might not only happen in banks, but it might also happen in homes.
Exactly.
Maybe somebody will just take somebody's face mask.
So the world currently has a problem with COVID-19. Please let us not have problems with face mask.
Exactly. Thank you very much, Mr. Lamin Kanyi from the Ministry of Health, and of course, Social Program Officer at the Ministry of Health. He has made it very clear that we need to stick to these preventive measures, such as physical distancing, use of face masks, and of course, proper use of hand sanitizers. And of course, Mr. Sehu Omar Silla, lecturer at the Gambia College School of Public Health and a member of the Risk Communication Unit, for making that contribution regarding myths and misconceptions of COVID-19. COVID-19 is real. Do not wait to be a patient to know that it is real. You do all the preventive measures to protect yourself, and not only yourself, your family, and your close relative for that matter. Mr. Abubakar Sankano, it has been a pleasure to host you here on GRTS. Viewers and of course listeners out there, I just want to add that this program will come your way every Monday, Tuesday, Wednesday, Thursday, and Friday on GRTS Television, QTV, Star TV, Paradise TV, MTA TV, and iAfrica TV, and of course on all private radio stations and community radio stations, to give you more information regarding COVID-19. The first thematic area we've touched on today is non-pharmaceutical measures, which these three gentlemen have spoken about, and we will also be having topics such as COVID-19 vaccination. We'll also be talking about health continuity of services, COVID-19 testing, screening, and we'll also be talking about the issue of safety for teachers and students. I think we have a lot of topics to talk about. So be rest assured that all your concerns will be taken note of during these panels that we will be having on all the televisions I've mentioned, and radios and community radios. I am your host, Momodi Jai, till we come your way for another episode of the COVID-19 Sensitization Talk Show. Bye-bye.
fii ci réewi Gambia. ndaw yi yëngu ci wàllum ñaw nag ñu ngi njëriñoo xam-xam yi jëlee SNS Institute of Creative Design ngir gën a yokk seeni man-man ci wàllum métier gi te kayiti jàng yitam yombal na seen am liggéey wala start seeni business boppa jàngukaay gi nag emut ci jàngal ak jox la kayit wante dinañ la xelal ci nooy amee liggéey ak waajal lii di interview mbaa bokkoo ci nit ñi yaakaar ne bu dul jaaree yooni gannaaw duñ fi mun a tekkee kon nag jaaral ci wakawel.info/Gambia ngir mun a am xibaar yu wóor ci anam yi nga war a jaar boo buggee tukki bitim réew mbaa soxla jàng ut liggéey ak mbiri jula fii ci biir réew mi.
Hello! There's a new update from your favorite GSM operator, AfriCell.
For all of you that have struggled to buy cash power beyond $7,000, AfriCell has done it again. The limit to buy cash power is now up to $30,000. Oh yes, $30,000.
Buy all the cash power you want from your AfriMoney account by dialing *777#.
Where AfriCell goes, nobody dares to follow.
It's an amazing offer. AfriMoney just got way better. The threshold for cash in and cash out on your AfriMoney has been increased.
Where it used to be 10,000 per transaction, now it has been increased to 30,000, meaning your AfriMoney account